Hey, what's going on? And welcome to Give Me the Medicine. You are here with your two co-hosts. I'm Des, and you have the lovely
Jay, and I'm so excited to be here with you, Des. But let's get into it. So my name is Jay. I've been a nurse for many, many years. Born in Brooklyn.
Okay,
Have
Brooklyn.
3 kids. Woohoo!
Nice.
Also Queens. I'm gonna book up Queens just for you. But and went to public school all my life. East Flatbush section. Been a nurse for many years, and that's how I met up Desiree.
Yes. So me myself, I'm just Nurse Des or Des. I'm from the block. I'm from Queens, and I have so much to share along with my co-host Jay.
Yes.
And it wouldn't be doing you guys any justice if we didn't bring it to you. So without
Great
any
topics,
further
great
ado,
topics.
we're gonna jump into our first topic of today. Our first topic is called grand rounds.
Yes. And you know what? I just want to share that as nurses, that we do have a little gossip section.
Yes.
And sometimes people would like to know, what are they talking about? Okay, now you are going to get the inside deal of what we actually think about and how we feel about situations.
Right.
So let's get into it.
Okay, so without any further delay,
Yes,
okay, so our first topic is from a social media post that we saw, is a glimpse of a post.
Give a background, yes.
Right, where we saw an ICU doctor mushing a family member in the face.
In the face, and it cut off.
Okay.
But she did write what was happening at that time. And I'm going to give like a short synopsis of what she said.
Okay.
She said her aunt was sick.
Right.
It seemed like a long time she was there. And you said you think the doctor was the ICU. Is the ICU doctor?
It's the ICU doctor.
But you think that she was in an ICU setting. I'm not too sure, but whatever, right?
I use context clues. And from his lab coat, it says whatever his name was, ICU doctor.
But we got to say this is a black family. And a non-black doctor,
yes,
right? We got to put that out there. The reason why I want to put it out there is because I don't want us to say anything different, like, okay, that's black family,
right?
Racism.
Yeah,
we're going to just put it out there, the facts out there, whatever. Okay,
right. And I would say, coming from a nursing background and also coming from and working in an area where it's a knowledge deficit, I think things get misconstrued. However, this post was inappropriate from what I saw on both ends. So
we're going to talk about the do's and don'ts.
All right.
So she said, I'm sorry to interrupt you.
No, you're good.
She said that the aunt been sick in the hospital. She wasn't getting any better. They got a phone call saying that the aunt is up. And let's say her name's Aunt Betty. Right? So we won't mix up anything. And Aunt Betty came. They say Aunt Betty is up and she's feeling much better and she wants to see the niece in question. Okay, so I guess the whole family came and the doctors want to do a family meeting. Once they went in a room.
Which is not rare or suspicious. This typically happens.
We usually do family meetings, especially with difficult patients and discharge planning. Because we are case managers and that's part of our job.
Right. And I specifically work with the ICU unit.
Absolutely.
And this is normal day-to-day
that's why we need your
exchange.
Expertise. That's why we need your expertise. I'm like the emergency room nurse, like hurry up.
Right.
But there is family meetings, right? And it's intense, as you know.
Right.
So when you have a family meeting, you have an interdisciplinary team, which involves the doctors, the nurse who is taking care of the patient, whoever is the consultant. It could be anybody from the neurology. It could be anybody from
any team. Whoever's caring for that client, they are a part of the team. And we all sit down and we discuss the client and goals of care with the family.
So the family's there in the room, which is the granddaughter that was the niece, and also the aunt, which is the sister of the family.
Right.
The grandmother was there, the mother of the patient. Also, there were other family members there.
Right.
So before they got started, I think it was a little bit of stop. We're not going to have this discussion unless I get all the names of whoever is in this room.
Right.
Right. Usually. My suggestion is that let the doctors introduce themselves. Let the person who's there introduce themselves.
Right.
And then at the end, you could ask, what is your name? So when you confront, so if I'm in the room and I say, Miss Desiree, I would like to talk about your mom. And you come out, what's your name?
I will give you my name because I'm professional. So like you're going to probably get my name and my title. That's the first thing I tell clients, patients, whatever you want to call them. My name, I'm the nurse, what I'm doing for you, and why I'm
So
here.
the temperature's set. So
right.
So we have to de-escalate the situation. So you would give the name.
Right.
Okay.
Now, so this is what all happened that led to the mushing, right? So we want to know what you guys think in the comments. Just throw your opinion and let us know what you think. And do you think how do you think this should have?
So they want to transfer the aunt
right
at the end. I did reach out to the person, and she did say they're going to transfer the aunt the next day, which is tomorrow. So
right,
I think we got to discuss the do's and the don'ts. The do's is for the family. What would you suggest as a family?
I suggest instead of having 10 family members, you should designate 3 or 4 people. Not even that's still overkill.
I think
yes,
one.
But a lot of times I feel like being just knowing that some populations are underserved. So
you're saying that it should be a controlled environment, saying that you shouldn't have like 5 or 6, 10.
Well, but that depends. That depends. If they going up there with the consensus that their family member is like at the end, of course, a family gonna be there, and it's up to us as the professionals to know that they are going through something right now. But we also, as the people in the public, need to be mindful that the doctors, they also are in the ICU, or when you have a very sick patient.
Yeah.
You are doing everything to keep that patient alive.
And the family member's anxiety is at 10. So
right.
They really can't hear anything that's going past 5, right?
Right.
Because they already have in their head that the aunt is sick, they want her out, Aunt Betty needs to get out, she's not getting better.
Right.
So I'm just saying, I disagree. I think all the families could be in there, but one person speaking.
Okay, that could be the case. I don't think that would have changed her temperament, whether it was one family or the other.
You did change your temperament, though.
She would have probably been the same.
You said you would give your name.
I would have gave my name first and foremost. I wouldn't have got offended because they wanted my name.
Okay,
Trust
so
me.
let's do role play. You say, okay, you the doctor, and I'm the aunt.
Hey, Auntie B. My name is.
Excuse me. What's your name?
I'm gonna get to my name. My name is Nurse Des, and the reason why I'm here is because we need to discuss goals of care for your family member.
And then I would like, thank you very much.
Yes.
What's her name? What's her name? What's her name? So I think that would be the first thing. I think that's great.
But as professionals, you always need to introduce yourself and let the person know who you are and what role you're playing in that person's care.
But also, if you want the family to be involved, I think that if Aunt Betty is alert and oriented ×3, she have a right for her privacy. If she wants whoever in that room to hear about her medical decision, I think that
they would have been
Betty.
Right. All right. So enough speculating. We want you guys to get in the comments and just let us know what you think.
And just and when we were reading the comments, we labeling it as dead on arrival or resuscitation. So the comments that really is good, we say we're gonna resuscitate it.
Yeah.
Some that's dead on arrival, it's like
just leave it alone.
That is mad rude.
Yes, it was some. I'll read 1 or 2 comments that we have here. So.
Go on, ma'am.
One of the comments says, so this is a valid point. One of the comments says, is there another video? Because this one shows her aggressively coming towards him and he responds by pushing her away. He doesn't need to write his name down. Her aunt can get it from the medical record. I actually advise people to request a complete medical record if they have any questions about the care provided.
Absolutely.
As for this video, people often, I'm going to repeat that, people often leave off what happened before they got out of pocket.
I love that. Who wrote that?
Charging someone while cussing is never okay, especially someone taking care of your loved one. How do you expect that to end well?
Yes.
That's from Kylo San Diego.
Oh, that's a good one.
Yeah, that's a good one.
That comment needs resuscitation.
Yeah, that was good.
That needs to be posted. How about the dead on arrival? I read one said, maybe your breath was stink through a mask.
Oh, okay. So I'm going to read one more comment and then we got to move on. This Mizzy _favorite Baldy said, I honestly think her breath was on fire.
Unbelievable.
And he smelled her stink breath through the mask. And she responded.
The author responded.
I responded via DM check.
So what you think was happening in that DM?
I think she
I
read him
wanna know
his
what's
rights.
going on in that DM. That
All
DM
right.
was probably say, meet me at that hospital, in front of that hospital. You got some damn nerve.
All right, guys, let us know what you think.
What you think?
All
Because,
right.
Nurses are patients too, and patients are nurses. So we can't have it out. Tell us what you want to hear from us.
Absolutely. Okay, now let's hop into our next topic, which is called DOA or resuscitate. And DOA is an acronym for dead on arrival. So we're gonna give you this.
And this is hot.
This is a hot topic.
This is hot.
This is hot.
Go ahead.
So,
I'm excited.
What we're gonna do? We're gonna introduce the topic. We're gonna put our little spice on it. And what we want you guys to do in the comments is let us know if this is a DOA topic, or we're gonna resuscitate this topic.
Yes.
If you want to know more.
We're gonna do CPR.
Okay.
And revive it.
All right. So in the news is this story about an actor. His name is Christian Keys. He's a prominent actor.
Okay.
He's been
I never heard of him, but you did.
Yes.
Okay.
I seen him. I never even knew his name, but he plays in a lot of the movies that I like, a lot of shows that I like, and I found out he's a number one. He's a best-selling author.
Okay.
So let's get right into it. So he had put out a whole hour-long monologue of allegedly being sexually
molested by a billionaire.
By a billionaire.
Okay, how many black billionaires
producer
out there?
And just my take on him, I seen him only on a lot of, well, I didn't only see him on a lot of Tyler Perry shows and a lot of I would say BET type shows, if that make any sense to you.
So if we're gonna like twist it back to like nursing, like
right.
mental health, right?
Right.
So he said he was sexually harassed by this powerful person,
right,
in which he was touched and manipulated, and he felt that he had to give in somewhat.
Right.
And it'd been bothering him and eating him alive and stuff like that. So I was making a joke, which wasn't a joke.
Okay.
It wasn't a joke, but I did in front of your husband. With Dwight Howard.
Okay.
And I said,
wait, those who don't know Dwight Howard, he's a former NBA player.
So I sent a video of when Dwight Howard was tempted to fondle an NBA player, a young NBA player.
Right.
I sent it to my brother. And I said, look at this. And he said, Jay, this is old news. Everybody know about allegedly Dwight Howard and his tendencies.
Right.
So I was saying, allegedly, do you think that we see certain producers have some type of tendencies too? I mean, let's be real.
I think
so. There's some truth in it.
I would say that when you are more powerful, you are more financially able to hide certain things. You have advantages over people. It's easy to.
So what do you think about, like, with P. Diddy allegedly had these type of
tendencies?
We're
gonna call them tendencies, right? Sexual tendencies.
Homosexualities.
Allegedly. So I think
allegedly. Do you think it's more of that or power or control?
See, I don't run in those circles, so I can't. I'm like an outsider looking in. From an outsider looking in, I think they have influence. So with influence, like you get away with a lot more things than a regular Joe Smo will get away with, and your tolerance is different. Like you are building up a tolerance that's like kind of different from the regular person that don't have those advantages.
Pornography, people tend to watch pornography and then get more excited and want more severe pornography. It's like steps by step.
Right. That's in the nursing, right? In the nursing, we call that tolerance, right? You get something, right? You want more and more of it. What you was used to getting, it don't satisfy you anymore. So you need more and more.
That's why it's important not to be exposed at such a young age. So allegedly, people were saying it was Tyler Perry. I'm not too sure. I'm not too sure about that at all because I saw his documentary. his documentary, Maxine's Baby.
Right.
And the reason why I don't think it's him is because he abused himself. Even though he was sexually abused, in the documentary, he never had the confidence.
Is this Maxine Baby? Is this a real story of?
There's a real documentary that's on Amazon Prime.
Okay.
And he grew up. Who's sexually? Tyler Perry.
Okay, so Tyler Perry grew up.
And he grew up in a dysfunctional home. A father who was an alcoholic, who was very physically abusive. His mother was very nurturing. On top of that, he was sexually abused by one of the family members.
Okay.
But the way he grew up and how he became himself,
how he overcame.
He didn't know, not overcame. He never overcame himself. I don't think even today he overcame himself because he always put so much pressure on himself. Mm-hmm. And he knows what abuse is. And I don't think he would take that abuse and put it on somebody else. That's my opinion, because he still have doubt in himself.
Right.
He doesn't have that power control as we see as other people like P. Diddy that always like, and you're like, wait. He's still humble. He's still, he has a son.
To me and you, he's humble. We don't know, like, so everybody have Tyler Perry, like I have Nurse Des and I have Des, right? And we have what we have. But outside of this, I could be a totally different person. I have my personal, I probably swearing and doing all type of stuff. So publicly, that's what you see, right? And that's his perception that we have of these people.
But I'm still going to stand on it.
I don't know.
If I'm wrong,
can't say
I'm sorry,
because
Christian, but it could be somebody else.
Right.
But I feel for him, like when they say abuser comes to abuser, he did. He abused himself mentally. That's how he became who he is. A person of power. We don't know.
Right.
Who is that billionaire that harassed him and sexually molested, not sexually.
Well, it's many producers out there that we may not know that may have money.
Right. But I just want to put out there that allegedly that you're saying his name. Right. I feel it's not him.
I think that time will tell. It will reveal itself, and we shall see.
He said he will. That should be our next. Give me
right. Next time you hear from us, like we'll have answer. We'll have more answers on this story. Maybe this is like the quiet before the storm. Maybe he have to work his way onto it.
Doing, as you said, is with Tyler Perry. So people are going to switch and say, "Is it?" Right. I mean, stop it. Like, let's be real.
And if we pull up comments that Tyler Perry had to say about him, he stated that this is like one of the best actors he's worked with professionally. Yes. So I don't know. We have to come back and see. I'm not judging anyone. I have to see what's going on.
But let's talk about the next medicine topic we're going to have of how you and I met.
Yes. So
that would be great.
So next time we meet up with you guys, we're going to tell you how we went from frenemies.
Not frenemies.
Not frenemies. What would you call it? Enemies.
To frenemies.
To frenemies. To now co-hosts.
Podcast besties.
Podcast besties, right? Yeah. You guys got to hear that story. It's very interesting.
It's very interesting.
And there's some lessons in that as well. But for now.
So it would teach us how nurses could get along with other nurses.
Right, exactly. That's
Black nurses.
We want you guys to take some of this with you guys on your day-to-day activities, festivities, or what have you. But with that being said, we're going to close out. We look forward to...
Thank you for coming to give me the medicine.
Yes, thank you for taking your time to get this tea from us.
Absolutely.
And we will see you guys next time.
Beth.
Thank you. You did great. Okay.
Okay.
Okay. We're going all the way.